All right, hey everyone. I'm really excited to have a special guest today. It is Dr. Salt and his friends in the background today. But this month is May, is Lyme Disease Awareness Month, and it really hits home for me because I personally have dealt with Lyme disease, and it's been a long journey for me. And the guy that you see right here next to me on my screen played a huge role in my own journey with chronic illness. He actually was the one that diagnosed me with Lyme disease, walked with me for many, many years, figuring out what was going on in my body and how to support me. And I'm so grateful, because if it wasn't for you, Dr. Salt, I don't think I'd be doing what I am doing today and helping other people with their own journey of chronic illness. So thank you for many reasons, but for also being here today. And he's going to share a little bit with us about just Lyme disease, since that's something he really is an expert in. But before we get into that, can you introduce yourself a little bit? Maybe, where did you start out with? How did you get to where you are today? Maybe your medical journey. Anything else you want to share about your life?
Sure. So I was in undergrad and I got a degree in chemistry, applied to 42 US medical schools and didn't get a single interview. So, and that was at a time where if you didn't have super high scores on your MCATs and all straight A's, you didn't get into med school. Yeah. And so I didn't have straight A's, but I did have I got 3.5 GPA in sciences, and because I have dyslexia, my non-science GPA was a little lower than that. So anyway, I tried to figure out what I was going to do with my life. So I went to acupuncture school. I went to acupuncture school for a year, and I was still, applying to med schools, and I learned about foreign medical schools. So I went to St. George's School of Medicine down in the Caribbean for 2 years. The United States invaded the country of Grenada. And so I was fortunate to be able to transfer to UCLA. And my medical degree is actually from UCLA. While I was at UCLA, I met Norman Cousins, who is a fairly famous author. He wrote a book entitled Anatomy of an Illness. And it's about how he really cured. You know what, I got Presto Changeo glasses on, and I have my window open, and I'm getting darker by the second.
So right, you're out in the jungle, or you're out in a safari right now, right? So
yeah, something like that.
Bright outside.
So anyway, Norman Cousins wrote a book about how he cured his ankylosing spondylitis with laughter. I found that quite interesting. So I started looking into sort of what he did and who he was, and I kind of became his office assistant as a third-year medical student at UCLA. Got extremely interested in what was then called and still called psychoneuroimmunology, the interface between the psychology, the immune system, and the nervous system. And now I think it should be called, like psycho, neuro, gastro, integumento, musculoskeletal, all et cetera-ology.
Right.
And that really started a journey for me. So then I went to residency, and in residency, when you're working 100 hours a week, you kind of get any ideas of creativity kind of squashed out of your brain. But shortly after, although I was doing acupuncture in residency, which was always amusing to my supervising physicians, but then in private practice, one of my very first patients was a person with chronic fatigue syndrome. And she was seeing what she described as a nutritionally oriented doctor down in Sacramento. I was living in Lake Tahoe at the time, Lake Tahoe, California. And I first thing I said is, a what? What? A nutritionally what? And so then I called this guy, whose name is Kirk Hamilton, and he sort of replugged me into the idea of holism and nutrition and everything that I had learned in acupuncture school, everything I learned from Norman Cousins. And from there, I'm board certified in family medicine, which is the regular old dominant culture medicine, but I'm also board certified in holistic medicine and in integrative complementary medicine. And I'm a certified practitioner with the Institute for Functional Medicine.
Mhm.
And I do lectures for the Institute for Functional Medicine. I'm currently serving on a COVID-19 task force with the Institute for Functional Medicine. So
Wow.
that's taking up a whole bunch of my time these days as we try to
Yeah.
understand the mechanisms of that nasty bug.
Right. Right.
And then because I live in Minnesota and we have lots of ticks, 30% of the ticks in central Minnesota and 2/3 of the ticks in northern Minnesota carry Lyme.
Mhm.
So, functional medicine, which is what I teach, is sort of independent of the diagnosis. And, people come because the dominant model of medicine has failed them. And so that just means in this area, lots of people with Lyme. So I had to dig in and learn a lot about Lyme.
Mm. So Lyme wasn't something that was necessarily on your radar earlier in the years. Was it something that kind of progressed as you saw more and more of your patients?
Well, my philosophy of medicine has always been my specialty is what my patients need.
Mm.
And so I treated my first case of Lyme disease in 1992
Wow.
in California. But, when I moved here, there was just more and more and more and more of it. So I needed to hit the books and learn as much about that bug as I could. So, I dug into so that the idea of functional medicine is it's different than conventional medicine. Conventional medicine, we have protocols. So, some bigwig, some on high person says,
Mm.
this is how you treat Lyme disease, and you get to use 1 month of antibiotic, and you get to do this, that, and the other thing. And that's how conventional medicine works. In functional medicine, we look at the basic pathophysiology, the basic mechanisms by which the bug replicates itself, infects cells, and all that kind of stuff. And then you try to devise treatments that interrupt it in as many places as possible.
Mhm.
And so what I had to do is really just learn the life cycle of that bug and how it, infects tissues in humans and, also in mice and in deer, because mice and deer are the places where it hides out.
Right. Right.
So anyway, and then devise treatment programs based on, the relevant medical literature and the relevant biology of the bug.
Right. Right. How many years? So you had a practice in New London, Minnesota, well, in Wilmer too, but in Painesville, many different places. But how many years would you say were you really focusing on Lyme patients?
Well, probably since about 1996.
Wow. Really before anybody would even talk about it, that even knew what it was.
Well, so it was a known epidemic within the complementary alternative field for years. And, even today, mainstream dominant culture medicine will tell you that Lyme disease is a self-limited disease. And,
Mhm.
if you get a month of antibiotic and you're still sick, there's something else wrong with you. It has nothing to do with Lyme disease.
Mm.
So,
Right, right. And I will say, I had heard of Lyme disease, but never thought it could apply to me. I heard of ticks, but I had the bullseye rash. My parents said when I was young, I was given maybe like a week of antibiotics and thought maybe that's it. But learning that it can stay in your body for a longer period of time, and that antibiotics isn't always going to be the thing that you know gets rid of it, and so many other things can layer on in life that it just bubbles over and the body can't withstand it. And I think it's amazing, of all the people, I mean, for those of you listening, Dr. Tom is very, very well known in the functional medicine world and the holistic and the Lyme world. And I knew him as Tom, just Tom, the one that we would go on some family trips together. We were family friends, have a lot of memories. And when I found out, when I got sick, I remember seeing you and thinking, whoa, this Tom is now Tom. Like, he is a hero to me. And to think that you were located in our hometown of population, what, 1,000? Of all places.
So I have skill sets beyond pushing the walkie-talkie button.
I love it. I just think what a gift. I know for me what a gift it was to people would fly from all over the country to see you, and here you were in my hometown. What a gift. So you talked a little bit about functional medicine. Is there anything you'd want to add about just kind of what functional medicine is?
So I like to say that functional medicine does what the Lipitor commercial says you should do. On TV, you watch the Lipitor commercial and it says, after a trial of diet and lifestyle, consider Lipitor. Well, if you do the diet and lifestyle right, you're not going to need the Lipitor.
Sure. Yep.
So we're really about individualized biochemistry, nutritional biochemistry. So if you have an issue, the question is, what are the antecedents? In other words, what is your genetic predisposition to that issue? And then what were the triggering events? So we build a timeline and we say, okay, well, you got sick here. What happened just before that, or even years before that, that predisposed you to it and then set it in motion? And then we look for what are called mediators. So mediators are the things that perpetuate the illness. And then we're trying to figure out how to normalize your biochemistry and give you better, what we call organ reserve. I like to tell a story that if my dad he lived until he was 93, but when he was 90, he was still flying airplanes. He was a very vital guy even at 90.
Amazing.
But I like to say, what if my dad and my son were walking down the street together, deep in conversation, and they accidentally walked out in front of a bus and bang, they're both hit by a bus. Which one's likely to survive?
Mm-hmm.
It's likely my son, because he has more capacity to heal at 30 something than my dad did at 90 something.
Yeah.
Right? That's organ reserve.
Right.
And so how do we increase organ reserve, and how do we normalize inflammatory cascades and all that kind of stuff? That's the biochemistry that we use to try to normalize illness. In functional medicine, we realize that you can have one disease with many different causes, or you can have one cause that results in many different diseases. So as examples of that, depression. Depression can be caused from inflammation. It can be caused from thyroid. It can be caused from B vitamin abnormalities. It can be caused from, mental, psychosocial, spiritual issues, lots of things. But at the same time, inflammation alone, we already talked about, it could cause depression, but it can cause heart disease, and it can cause arthritis and autoimmune disease, and just about everything else. So we're always looking at it just in a slightly different way than maybe the conventional medical doctor looks at things.
Right. And I appreciate just the individualized approach, and that you look at the person as a whole. You look at the physical things, the spiritual things, the mental things, the emotional. It's all plays a role into one's health. So
yeah, and the other thing that happens is you go to the doctor and they say, well, Lyme disease, that's just not likely. Well, if it isn't this that is likely, and it isn't this that is likely, and it isn't this that is likely, and it isn't this that is likely, then pretty soon you get down here, and even though it was unlikely to begin with, it starts to become more likely.
Right.
So the more things you get rid of, and that's the downfall of holistic medicine, is that we sometimes say, conventional medicine's no good. Mm-hmm. Actually, conventional medicine is the starting point, because if you have, some disease, whatever it is, if there's a quick conventional way to make it go away, why wouldn't you want to do that? Mm-hmm. But if you don't have that conventional normal problem, or maybe they thought you did and they treated you for it. So many people with Lyme disease, they're told, now your problem is you're depressed. So they go, well, fine, I hate the way I feel. Give me an antidepressant, and it doesn't help them. Right. So they go to a psychologist, and the psychologist says, well, gosh, you don't seem to have any serious psychological problems. And, it goes on and on. Well, at some point you get down to that point where you say, well, we have to start thinking about other things that might be wrong.
Right, right. Yeah, no, that's good. So can you define what is Lyme disease? How do you get infected?
Lyme disease is a infection with a bacterium, a spirochete bacterium of the Borrelia, um, and there's many of them. So Borrelia burgdorferi is the most common and the most well known, but there are many other Borrelia subspecies that can cause Lyme-like symptoms. So it's an infection with a bacteria, spirochete bacteria. This particular spirochete, usually the vector is a tick.
Mm-hmm.
It's an Ixodes tick, which are the little tiny deer ticks. Not a dog tick, not a wood tick, but the little tiny, they're the size of a sesame seed. And they live on mice and they live on deer. They're called deer ticks generally,
Mm-hmm.
but they're actually more prevalent on mice.
Hmm.
And so you're out in the woods or you're walking in the grass or whatever, or your dog is out in the grass. Like just yesterday, we were on a walk and I had a tick crawling up my hand. Well, I wasn't off the pavement, but my dog was. So,
Right.
and the dog, of course, takes the chewable pills. So the I think the ticks jump off the dog onto me because the dog's toxic.
Probably.
Yeah. So anyway, somehow you get a tick. Then you get a bite from the tick. And there's controversy about how long the tick has to be on you. Some people think, if it touches you, I think that's probably not true. Other people say that if it's attached less than 24 hours, it's a low risk bite. I think that a bug can move pretty quickly. So somehow this bug gets from the tick into us.
Yep.
And then from there, it starts to replicate and it starts to wreak havoc. And mostly what it's doing is causing inflammatory changes. And so a person with acute Lyme disease, which is the thing that everybody agrees exists,
Mm-hmm.
will get a flu-like syndrome. So if you get the flu during the summertime when it's not flu season, and you live in tick country and you live in Lyme country, you should be thinking, ooh, this is probably Lyme disease.
Mm-hmm.
Now, some people get that acute response and they go to the doctor and the doctor says, well, we'll run a test. Well, it takes several weeks for the test to become positive.
Mm-hmm.
So if the test comes back negative and the doctor doesn't understand the laboratory, which is unfortunately all too common, they will say, nope, it's not Lyme disease. People even come in with bullseye rashes like you did,
Mm-hmm.
and they say, well, we'll do a test. Well, even the Center for Disease Control agrees. If you have a bullseye rash, that is all you need, and appropriate symptoms, that's all you need for a diagnosis of Lyme disease, and you should be treated immediately.
Mm-hmm.
But people are, for reasons that are unclear to me, Lyme is a very political disease, and people are very reluctant to treat Lyme disease, even acute Lyme disease. So they do the lab test, it comes back negative, which we expect it to come back negative in the early stages of the disease. And they don't get treated. So then, by the way, the bug, Borrelia burgdorferi, is a spirochete. There's another very famous bug called Syphilis, which is also a spirochete. Mm-hmm. And this bug works its magic in ways very similar to syphilis in terms of not the way you get it. It's not as much fun to get Lyme disease, but the way you get Lyme disease isn't the difference or isn't the same, but the way it behaves in your body once you're infected is very similar. So then you go on to get secondary and tertiary Lyme, which doesn't respond to antibiotics very well at all. Another way that you can get Lyme disease is by the same process, but then instead of having that initial robust immune response where you have what appears to be the summer flu, you just get an indolent course where you just sort of dwindle down. You never get really sick, you just dwindle down. And those are people who are not mounting a robust immune response initially. And so they just don't have, for whatever reason, the immune capacity to fight this bug off completely. Hmm. By the way, most people who get Lyme disease do fight it off by themselves.
That was going to be one of my questions too. Can you get bit, get the Lyme bacterium, and then get over it? Or does it always live in your body?
most people get over Lyme disease all by themselves, never even know they had it.
Mhm.
And then there's people who, they get really sick, they go to the doctor, and for no really good reason, they get a set of antibiotics, a course of antibiotics, and it cures them, and they still never know they had Lyme. And then there's people who go and they eventually get tested, the test is positive, they get treated and they get better. And then there's the people who don't get better because it was, longer lasting and they had secondary, tertiary illness.
Mhm.
And those are the people, of course, that I end up seeing.
Right, right. So when the people that came to see you, what are the most common symptoms that you saw for people that you would recognize as Lyme disease?
Severe, unrelenting, life-altering fatigue.
Mm.
That's number one.
Okay.
Number two, roving, meaning things that move around your body, roving joint and muscle pains.
Mm-hmm.
So, your knee hurts so bad, you feel like you just can't walk. You feel like you sprained it, the worst it's ever been sprained in your life. And then 2 or 3 days later, your knee's fine, but your shoulder feels the same way. There's no orthopedic mechanism to explain why you would hurt so bad you can't even walk. And then 2 days later, you're perfectly fine, right?
Right.
So it's a weird kind of of joint and muscle pain. And then cognitive impairments, people call it brain fog or memory loss.
Mm-hmm.
And then another weird one that is very common is bottom of the foot pain, like plantar fasciitis. So those are the big ones. People have other, if you name a weird symptom, somebody with Lyme has it for sure, but those are the major symptoms.
Yeah, that seems to be the common theme. However, for myself, that wasn't always my biggest symptoms. I had fever, flu-like symptoms, the stiff neck.
Mm-hmm.
Fatigue wasn't necessarily my number one symptom. So I thought, I probably don't have Lyme disease because I don't really have the common, it doesn't robe, it's just in my neck and it's painful and it's,
So the other criteria, if somebody has been sick for a while and they've been to the doctor several times and they have not been given an obvious diagnosis that makes sense to them, because unfortunately what we do as doctors is we try to pigeonhole people, right? And if you're told you're depressed and you're thinking, well, gee, am I depressed? And you ask all your friends, do you think I'm depressed? And nobody thinks you're depressed. Maybe you're not depressed, right?
Right.
And so if you have this longstanding illness that just isn't responding conventional care and you don't have a diagnosis that makes sense and you live in a Lyme endemic or travel to a Lyme endemic area, you need to at least entertain that diagnosis. I have a patient who's from Illinois, central Illinois, and she saw me and we did some tests and decided that it was Lyme disease, and she went back to her doctor and the doctor laughed and said that that was ridiculous. There's no Lyme disease in central Illinois. And she said, yeah, but we have a cabin in northern Minnesota. And he said, yeah, but there's no Lyme disease in central Illinois. And so I recommended it as an educational opportunity for that doctor that he watched the movie Trains, Planes, and Automobiles, because people travel these days, right? And,
it's true. Right. And so, but what we're probably discovering too is it is more prevalent than what we think. It's not always just found. Isn't there cases in every state as of now that Lyme has been found in ticks, or is that not a true statement?
Frankly, I don't know if that's a true statement or not. I know that it's very widespread. It's much more common some places than others. I can tell you that in central Minnesota, 30% of ticks are infected. In northern Minnesota, 2/3 of them are infected. Wisconsin is similar to Minnesota. Some states have very low prevalence. Florida has very, very low prevalence.
Sure.
But again, people are traveling, right?
Right. And wouldn't you say that some of the top maybe things that have been diagnosed from maybe other doctors is chronic fatigue, fibromyalgia, and just depression, like some kind of cognitive. Would you say those are kind of the top three that people, those are like the basic overhead of just, you're tired, you're sad, you have pain?
Right. Yeah. Fibromyalgia, chronic fatigue, depression, arthritis, um, polymyositis. Um, yeah.
Yeah.
There's lots of diagnoses that people get that turn out when you treat them aggressively, they don't get better.
Right.
And, the bottom line is it's okay to be wrong with your diagnosis. It's just not okay to stay wrong.
Yeah.
So, if you're treating somebody appropriately for a disease and they're not getting better, it's time to start rethinking what you're doing.
Yeah. Right.
And so that's what leads, like many times, and you would be an example of this, many times people come to me and I make all kinds of mistakes before we get to the bottom line, right?
Well, I was a difficult patient. I had many layers to my.
Well, but everybody does, is my point. And so, people come in and they have kind of very vague symptoms. I mean, I just don't feel good. Yeah, but tell me more about that. Well, I hurt. And so what does that mean? Well, I get fevers. Okay, well, what does that mean? Sometimes I can't think. And so you just have to chip away at it and, try this and try that and try the other thing. And,
Right.
Right.
Well, it's the layers. Sometimes don't you think that oftentimes Lyme comes with friends, or it attracts, so you've maybe parasites or other viruses or heavy metals or co-infections? Do you see that common with people? Is it common to have multiple things going on at once, or just the Lyme?
50% of people with Lyme have a co-infection, and something like 20% have 3 co-infections. So hitchhikers are very common. And it's also true that when people have been sick for a long, long time, they have all kinds of other overlays. They may have mitochondrial burnout. They may have multiple chemical sensitivity. They may have developed multiple allergies. They may have developed all kinds of psychosocial issues surrounding, being isolated and feeling crummy all the time. And so, you have to work through all of that stuff. And sometimes Lyme isn't the thing that is the most useful thing to treat right up front.
Sure.
And so it can be very complicated.
Sure. So do you think testing is accurate?
A positive test is very helpful. A negative test is less helpful. Mm-hmm. So especially in the acute setting, the standard Western blot, the 2-tiered Western blot, can be falsely negative 50% of the time. So that's why the International Lyme and Associated Disease Society. So there are 2 major groups of people interested in Lyme disease. One is the International Lyme and Associated Disease Society. The other is the Infectious Disease Society of America. The Infectious Disease Society of America is the more mainstream allopathic group. They're the ones who tell us that chronic Lyme disease simply doesn't exist.
Sure.
The International Lyme and Associated Disease Society tells us that Lyme disease is real, chronic Lyme disease is real, and the diagnosis is clinical, supported by laboratory evidence. So there are a number of labs that we might do, all looking for the Lyme bug in slightly different ways. Some of them just smoking guns. Some of them are actually DNA analysis of the bug. Some of them are antibody analysis of the bug. And so we look in many ways. We collect the history to get the symptomology. We look at labs. We look at it all. But no one thing says, aha, you don't have it.
Sure. Right. That's what's tricky.
That's what's very tricky. Mm-hmm. And, sometimes, in medical school, we're taught that if you don't take out a certain percentage of normal appendices, you are undertreating appendicitis. And it's also true with Lyme disease. We treat some people who don't have Lyme disease,
Mhm.
and of course, those are the ones that go somewhere else and get diagnosed with something else and get treated and get better. And then that's where the mainstream doctors tell us that all of us Lyme guys are idiots and
Yeah.
don't know what we're doing. So again, it goes back to good medicine. It's really important
Right.
to be a really careful diagnostician and make sure you're not missing other diagnoses.
Right. Right. So what are some of the treatment options? What are some maybe that you used with your patients that you saw was really effective? And everybody's different, I know. So
Yeah. So, well, first of all, in the state of Minnesota, there was a moratorium on prosecuting doctors for treating chronic Lyme. That's now passed, and there's now apparently some talk about disciplining doctors who treat Lyme who use long-term antibiotics.
hmm,
Long-term antibiotics have been a mainstay of chronic Lyme treatment. However, I've evolved with that, and they're not very effective.
mhm,
And I think there are other agents that are much more effective.
yeah,
So what I like to call a full court functional medicine press, functional medicine full court press starts with diet and lifestyle,
yeah,
starts with sleep. You gotta sleep, and you gotta sleep 8 hours minimum.
yeah,
And so one of the things we got to do is figure out how to help people sleep, because most people with Lyme disease have disturbed sleep.
hmm,
And then movement. Movement is critical for your immune system. So how do we get these people who are chronically fatigued, have chronic pain issues, how do we get them moving?
right,
And then from there, stress management. How do we help them manage the stress? Because chronic illness comes with a lot of stressors, ranging from social isolation to financial stress.
right.
A large percentage of my patients were losing their homes because of their
Mhm.
chronic illness. Um, and then, relationships and nutrition. So all of that basic fundamental lifestyle stuff, super important. And then I like to do some biochemical tests. One I call a Nutrival, or there's another one called organic acid profile. And that helps us look at their underlying physiology. And what I like to say is it's not a test of nutritional deficiency, it's a test of nutritional efficiency.
Yeah,
So you might well have, just take the example of B12. Maybe if you did a serum level of B12, you've got plenty of B12 in your serum,
mhm,
but your methylmalonic acid or your homocysteine is not normal, in which case that suggests that you don't use B12 normally. And
sure.
so there's other things we may need to do to help your body use B12 more efficiently. And it goes on like that for nearly every nutrient.
Mhm.
And then, so after we get the lifestyle issues kind of squared away and we get the basic nutritional efficiency squared away, then we start looking at nutrients that may have significant anti-Lyme effects. So one of them is stevia.
Mhm.
So I use stevia quite a lot for Lyme. I use something called biocidin quite a lot for Lyme. I use berberine and oregano oils quite a lot for Lyme. And I like to cycle them 6 weeks on and 2 weeks off,
Mhm.
because there is an exponential growth phase to the bug, and then there's what's called a steady state. And in steady state, the bug is not very susceptible to most antimicrobials. So we take you off the antimicrobials for a couple of weeks and allow the bug to start to grow again. And now it becomes much more susceptible to the antimicrobials. Then we hit them again with a full course of antimicrobials, take you off again for
Mhm.
2 weeks, and so on.
Right.
So that's sort of my general approach
Yeah.
to the treatment of Lyme disease.
And you had other things like Myers cocktails or different things like that.
So, yeah, so especially in the context of these nutritional inefficiencies, how do we bolster you up and get your systems back online and functioning quickly? So we use intravenous nutrition. So a Myers cocktail is basically like a multiple B vitamin with some magnesium and vitamin C added. I use very high dose intravenous vitamin C sometimes.
Mhm.
Sometimes we'll give glutathione. I also used to use, I don't do this anymore just because I've closed my practice, but I used to use hyperbaric oxygen,
Yeah.
um, used to use UV light therapies.
Mm.
So there's a lot of other things one can do, and there are other medicines that people use, but my experience with medicines is that they're really not, so far they're not as effective as we'd like. Medicines and nutrients for that matter are often extremely useful in the test tube, but that test tube effect doesn't really translate into the complexity of a human body.
Right. Right. Yes, you can't see how that's going to turn out in it, because we're also individualized and different. And so I think that's what I've learned is what works for one person doesn't always work for the next person. So, a lot of people, when they heard I had Lyme, well, you have to do this because my so-and-so's friend's daughter's neighbor worked perfectly, and so that can be discouraging then when it doesn't work. And so figuring out individualized, this is what works for me. But I think having that foundation is key for everyone.
And what that really means is that it's extremely important to create a rapport, and so that the patient understands that.
Yes.
Because the problem is, if I say, okay, you've got Lyme, you've come to me, I'm the big giant expert, and I'm going to give you this, and if you don't get better, and if we haven't had a conversation about this individuality,
Yeah.
and you don't get better with what I gave you, it's like on to the next guy, right?
Right.
And if all you ever get is the person you're with first idea, you'll never get better.
Right.
You got to stick with somebody and give them an opportunity to find out how your body responds to things.
Absolutely. No, and I
You
think
know, if you I
go
was
ahead.
going to say, if you go to somebody and they want to treat you exactly the same for years on end, that's no good either. The person has to be listening to you, hearing your feedback, and making adjustments based on your feedback.
And that's what I was just going to say. That's what I appreciated so much about you is you validated, first of all, that there was something, that I wasn't just crazy.
Well,
And
it was an addition to being crazy.
okay, I'll take that. Crazy and actually something going on. But that rapport with patient-doctor relationship is so important, because I did trust you and I knew that you just wanted me better. That's all you cared about. And so whatever method that we needed to do and trying different things, and I trusted you because I knew you had my best interest in mind too. So that is really important.
And when people are desperate, they're going to try other things. And so, people try other things. And if you come back and you say, hey, you know what, I tried X and it really helped me. If your doctor gets mad at you about that,
Mm-hmm.
then his ego is too involved. And his issue is not your best interest.
Right, exactly. Yes. So a couple more questions for you. Do you have any prevention tips, or what do you do if you get bit? So we're entering tick season, and in Minnesota, I just found one on Paul, my husband, just crawling in our house, and it's like, okay, what are your some tips for prevention and what to do if you do see a tick on you?
Well, so first of all, prevention. Depending on how concerned you are with toxins and sprays and all that stuff, there is a product called pyrethrin, which you can treat your clothing with. So you spray this on your clothing. It'll actually last through several washings. You spray it on, let it dry, and then ticks will be killed pretty much on contact with this stuff. I mean, it takes a while, but once they've walked on your pants or whatever, they will die.
Sure.
And then you want to spray just the opening areas where your skin is exposed with something. I prefer, there's an extract of black pepper, which the name of it escapes me at the moment, but I prefer that over DEET just because at least it came from something natural, right?
Right.
And it's as effective as DEET. So I use that. There is a product called Nature Side, which is actually cedar oil.
Mm-hmm.
And you can actually spray that on your yard and whatever, and it will kill ticks and repel ticks and so on. So there's you can spray your yard just so that your basic
Sure.
at-home living environment. And at my house, we've got deer in our yard every night.
Right.
And so, they're bringing ticks into the yard. So spraying the yard with this nature side stuff just reduces the tick load. Then there are things called tick tubes. They're basically like toilet paper tubes, the cardboard part. And in the middle of those tubes, there is cotton that's treated with pyrethrin. And you throw those around in the bushes on your property, and the mice take those pieces of cotton and line their burrows.
Huh.
So every time the mouse goes back into its burrow, it gets a nice tick bath.
Yeah.
And it can reduce your tick burden in your property by as much as 80%.
Wow.
So I have a patient who's an engineer. He's got a northern Wisconsin cabin, and he started using these things. And he would take a white piece of felt and drag it along the ground near some trails that he walked on his property and count the ticks. And after a couple of years of using these tick tubes, he was seeing dramatic reductions in the number of ticks he was picking up. So tick tubes are another way to just reduce the tick burden in your immediate vicinity. Checking yourself if you're outside and out and about, or if your dogs have been out and about, checking yourself every evening carefully for ticks, and knowing that they like hot spots. So they like groins and armpits and ears and hair. Make sure you check those areas very carefully, and so that they're not attached too long. There's the risk is lower if the tick is attached for less than 12 hours.
Sure.
So if you can get it off of you before 12 hours. Now, when you're removing a tick, you don't want to just grab it by its body and squeeze it and pull it off, because you're basically squishing its body and having it push everything into you.
Yeah.
You want instead to get underneath the head of the tick, or underneath the body by the head, with a pair of tweezers, or they make things that are actually little V-shaped, deals, and pick it up that way. Get underneath the body so you're not squeezing the body.
Right.
That's how you remove a tick. Now, if the tick is attached to you, I would probably start myself on either berberine or oregano or biocidin or stevia, and I would take that for a while. Because if you live in a highly endemic area, if you don't, then you can wait to see if you develop a rash. If you develop a rash, I would be armed with this information. The Center for Disease Control says, if you have appropriate symptoms and a bullseye rash, that is all that is necessary to diagnose Lyme disease. So if you get a bullseye rash someplace and you go to the doctor and he says, well, let's get a test. You say, doctor, the Center for Disease Control says that symptoms and a bullseye rash is all you need. You don't need a test. And in fact, when the rash is present, the test is likely to come back negative.
So interesting. Yeah.
So anyway, and then, get treated appropriately with antibiotics or herbal treatments or whatever you want to use, but treat yourself.
Right. Thank you for those tips. Those are fabulous. I think that's something we can all just be reminded of, that it is important to check for ticks, especially if we live in a tick infested area. Because those things can really wreak havoc on the body.
In the movie Under Our Skin, which is a documentary about Lyme disease, one of the people in the movie, kind of the main character, who's a forest ranger, he says, he lays out all these hundreds and thousands of dollars worth of medicines on the table, and the havoc that it's wreaked on his life and the economic hardship and so on. He says, it's really a shame that, if this would have been caught early, $20 worth of antibiotics probably would have cured this.
Right. Crazy.
Yeah.
And I mean, you can get resurgences. So some people say, well, I had, I even tested positive for Lyme, took the antibiotics, and it's done. I mean, it could resurface back up later in life.
Well, so I don't know. People, that's a meme, right? That's what people talk about, and it may well be true. but it's also true that they probably live in a tick endemic, Lyme endemic area. So did it resurge or did they just get it again?
Yeah. Right.
It's hard to know.
Right. Right.
You know, people are very attached to their beliefs, so I don't try to convince them otherwise. I just say, well, I don't know, you're sick.
Yeah.
Let's try to get you not sick.
Right. Exactly. So for those people that maybe are listening that have Lyme disease and it's been a really long journey for them, any words of encouragement? You know, I think when I saw you, I was just looking for, is there hope to be better? You know, what is there hope? What's some encouragement for those that are in the midst of it?
Well, I would say that the majority of people can be helped. I would say that it's not always easy, as you know, and it often takes a lot of iterations, right? We try this and it works. Great, keep doing that. But we tried this and it didn't work. So let's stop that and try something different.
Yeah.
And the problem is people get attached to it. They're so afraid to stop doing something. So instead of stopping this one and trying this one, they just stay on this one and add that one. So, you know, be willing to let stuff go and try new things, because once you're on 100 pills a day, it gets pretty discouraging.
Yeah.
You have to be willing to sort of triage which thing is helping and which thing isn't. But, you know, it's like backpacking. You're not going to get to your nighttime camp unless you take the next step. And it's the same thing with Lyme disease. You're really not going to get better until you take the next step. People get discouraged and they say, that's it, I'm done. I'm never trying anything again.
Right.
Well, you're probably not going to get better with that.
Right. Right.
You just have to do as they say in Frozen, the next right thing.
The next right thing. Yes, that's some good wisdom right there.
Yeah, it is. You have to try to do the next right thing. Now, you might be out of money, so you can't do the next whiz bang thing, but you can work on how am I going to get better sleep.
Right.
You can work on how am I going to manage my stress? How am I going to live my life with this disease instead of letting go of life because I have this disease? How am I going to live a meaningful life with this disease? There's always something that you can be working towards with Lyme disease, even if you don't have money. If you do have money, well, then you want to try the next whiz bang thing. If it's another herb or another supplement or another whatever it is.
Right. Right. Well, thank you. This has been really awesome. And I'm going to end here in a second by asking just what you're up to now and how people can get in touch with you. But you said something to me at one of my appointments that just really was kind of inspiring to me. And you said something to the lines of like, I can't be your healer, but I can be your guide, and I'm going to walk with you through the ups and the downs. It's kind of like that analogy of the camping. You know, I'm not your savior, but I'm willing to walk with you through it and be your guide. And I think that is probably one of the best gifts that I could have received through my own journey of chronic illness. So I am so thankful to you for the compassion, for the belief in me, for the encouragement, for your wisdom in so many ways for my own journey. And because, you know, you've shown me that kind of compassion and love, that I want to do that for other people now. And so here I am as a holistic health practitioner, getting to walk with people. And so the trickle effect keeps going on. Your impact is now continuing on. So I'm personally grateful for you. And I know the people that I've talked to being in your office that were getting treatment saying their lives have completely changed because of seeing you and getting treatments and different things. And so I know that you've made a huge impact on a lot of people, maybe more than you even realize. So thank you for being here with me today. And so tell us just really quickly, especially for the people that are listening on my end, what are you doing now? How can people get in touch with you? Is there new things that you're working on?
Well, so I was working on something called the Peak Wellness Academy, and I'm still working on that. But with the COVID-19 and the economic downturn and people not having any income, that idea is for another time. So I'm actually restarting my practice. We're going to start virtually at first, and then I will probably reopen my practice under a new name. We won't be Third Opinion anymore. We'll be Just Be Well. It'll be cash-based because holistic medicine is something that insurance companies don't embrace, unfortunately. And what they end up doing is they try to, they pay for things, and then 3 months later they say, well, remember when we paid you that money? We want it back now. So it makes it very hard to have a business where, you, number one, they take the money back, and number two, they tell you can't bill the patient for the service.
Right. Yeah.
So it's just going to be a cash practice. We're going to try to make it lean and small and all that kind of stuff. My website is justbewell.info. We have a link to something there called the Whole Life Immune Support. So that's actually a questionnaire you take, and based on the results of your questionnaire, there's literally over 1 billion combinations in this questionnaire. So the results you get are literally one in a few 100 million or 1 billion.
Wow.
And it gives you very specific ideas about how to support your immunity in every domain of life, whether it's your sleep or your nutrition or your GI function or your endocrine hormone function or whatever. So that's something we have. And right now that's normally like $150 or something. And we have a discounted price of about 47 or something. And then because of COVID and we want everybody access, we also are just giving it for free. So sort of, whatever you can afford. If you can afford full price, well, we'd love that because we're trying to feed our families too. If not, we have a $47 level and then free. And it's all the same thing.
Yeah.
It's not changed in any way, but it's just, we want everybody to have access to it. And we'd also want people to have the opportunity to support our work. So
right. Well, it's very generous, and please do. And it's on your website. Is that correct?
Yeah, there's a link to it on the website.
Okay. Yeah, check it out. I think it's a fabulous resource, and you are an incredible wealth of knowledge. And so I highly recommend everybody to go and follow. And Dr. Salt, and you said Just Be Well. Is that another avenue, like your Facebook or?
Yeah, Facebook is Just Be Well, and our website is justbewell.info.
Yep.
And our old website, thirdopinion.us, points now to Just Be Well. So,
okay.
Yeah.
Wonderful.
And if people are interested in our clinic, they can, message us through Facebook or whatever, and we'd be happy to put them on our email list.
What kind of things will you be offering with the clinic opening? Or you said for now it's going to be appointments, but what is maybe the goal, or what would you hope to have offered or offer?
Well, we're going to do, what I call tertiary care functional medicine, which means, full-on functional medicine. So I have a whole menu of lab tests that can be done at home, either urine or stool or saliva or whatever. And we will just be looking for those antecedents, triggers, and mediators, and genetic predispositions, and normalizing nutritional biochemistry and so on, like we talked about during this.
Awesome. Well, I think that's wonderful. I'm excited for you. I think there's still such a need of people looking for answers. And so just coming at it from different angles is really important. And so I'm really grateful you're in the community and available to really anybody virtually right now. So, yeah. Is there anything else you that I forgot to ask you or you wanted to say? You've been dying to say?
No, you did a good job.
Okay.
No.
Thanks. Well, I appreciate your time so much, Tom, and we'll be in touch soon.
Okay, we'll talk to you later.